Hello, I'm Dr. Paul, and this is my beautiful wife, Lynn. And today we're going to continue talking about diabetes. In the last video, we talked about low blood sugar and the effects of having low blood sugar and the symptoms. And so we're going to pick up now and talk about how to correct those low blood sugars, which is the best way to get somebody out of a crisis of low blood sugar and back into a level of normal blood sugar where they can once again function. And a lot of it has to do with in how bad a shape they are. If somebody's at the point to where they're comatose, then you need to give them a injection of the emergency kit,
the glucagon.
The glucagon that's in this emergency kit that's a prescription. And it's got a syringe with the vial.
Excuse me.
And you fill the syringe with this substance that's in this vial and inject it into the person with low blood sugar. And you can inject it anywhere there's enough skin and muscle to put it in. It can be in an arm, in the abdomen, in the buttocks, in the leg, any place there's some place to absorb it. But if it's not severe and you observe that a person is just having symptoms that we previously described, there's some ways to easily bring your blood sugar back up. And one of the easiest ways is sugar water. Just about everybody has some sugar around somewhere, and you can mix a couple of teaspoons in a cup of water and drink it, and that works pretty fast. Honey works good, milk works, and one of the things that a lot of people carry are what they call dextro tabs or gluco tabs, and they are something that you get at the pharmacy, and it's a pill about the size of an Alka-Seltzer tablet that you dissolve in your mouth, and it's all glucose, and it raises blood sugar quickly. I remember I've had some of those in the past, but I've done just as well. When I needed a blood sugar boost, I've done just as well with sugar or honey.
Well, and I'm going to interject here. Sometimes as a spouse or as a companion to an individual with low blood sugar, what you're going to notice if they're getting low blood sugar, experience will show you this. You might be having a conversation and they're not quite tracking. Now, it's not that they're ignoring you, they're just not tracking. And so when I notice that, I'll say, I think you need to check your blood sugar. At that point, it isn't so low that you're going to have to resort to the emergency shot like you've just been shown here. At that point, he can go in and check on it. But if it gets a little lower, then you're in the range of having to come up with the sugar water or the honey or whatever. And the range where that is not going to be effective and you're going to have to use the injection is where you determine that trying to get something to be swallowed may be an issue and may be a problem. In other words, you don't want him to choke on what you're trying to get down to make things better, because now you've even made things worse. So it's just, you've got to learn how, when your companion or your relative is learning to manage their blood sugars, you kind of have to go along with the program and learn the management from your side of things to see when things are going a little south.
That's very true, and she's been very helpful to me. So some of the other things that can raise your blood sugar quickly are fruit juice and candy. But you want to be very careful not to overdo it. When you get low blood sugar and you start eating candy, you feel like you need more and more, and if you keep eating it and don't just go sit down and give yourself a chance to absorb all of that and have your blood sugar come up, then later on in the day your blood sugar gets way too high, and then you have to take insulin because your blood sugar is out of hand, and now you're trying to get it back under control again. And that's like being on a teeter-totter. It goes too high, and then it goes too low, and then it goes too high, and then it goes too low. And when you get in a situation like that, it's difficult, and it's hard to control, and it's very frustrating. So when you're coming out of a low blood sugar, don't overdo it. Eat enough to where you'll get some glucose into your system, and you won't keep getting lower, but don't eat so much that you're going to have problems a few hours later.
And also, if you're with somebody who's going to use candy, make sure, like I said, that it's a point that it's okay to suck on the candy or swallow the candy, whatever, and it's not going to be a swallowing issue.
See, here's what I keep in my pocket. These are Christmas candies.
Oh, little peppermints.
Yeah, these little peppermints that you see at the restaurant after you finish your meal and you're on the way out the door. They have some sitting there for you to take as a sweetener after you get through eating. Well, I keep 4 or 5 of these in my pocket, and if I get low blood sugar, and I can pretty well feel it now, I'm used to it. I'm used to knowing what it feels like, then I'll just pop one of these Christmas candies and give it a few minutes, and it brings my blood sugar up. So, and then there's always the glucagon injection if you need it. If things don't work out and you can't get any blood glucose in, then you'll have to take a shot. Now, through the years, I've had a lot of ups and downs and problems with blood sugar, diabetes, and since we've been using plasma energy, I feel like I've really gotten a handle on it, and I'm a step up from where I used to be. I drink a lot of the plasma energy water, and in fact we use it for everything. And some of the benefits that I've gotten from using the plasma energy are better blood glucose control. It's not as hard for me to keep my blood sugars down. My hemoglobin A1C average is below 6. Now, the American Diabetic Association recommends 7. And if you go with a 7 hemoglobin A1C for long periods of time, you're going to get neuropathy, cataracts, and all kinds of other complications.
So you want
So-
that number to be lower than the 7 number.
Lower than 7, you bet.
What is a normal person that has no diabetes? What would their range be?
4.7.
Okay.
Okay, so even at 6, I'm higher than normal. But that's better than 90% of all the diabetics that are in the world, because the medical profession does not tell you to get it down to 6 or below. They say 7 is fine. Well, 7 is not fine. 7 is going to give you long-term complications. So be aware of that. Another thing that the plasma energy has done for me is decrease my hunger. So when I sit down to eat, I don't eat as much as I used to. And during between meals, I never snack. I'm just not hungry. And we went for 10 days just on plasma energy water for meals, and we had no loss of energy. Everything was fine. We had no hunger pangs, no discomfort.
We weren't cranky. We didn't have headaches. Now during that time, because of social things in the family or whatever, we ended up with what I called 3 dish meals. But for a 10-day period, most of what we considered a meal was drinking our plasma energy water. And now we use our plasma energy water in anything that requires water in cooking, whether it's coffee, tea, soup, a recipe that you need to add water to. Our go-to water is our plasma energy station water.
Another benefit is no neuropathy. Now, neuropathy is a lack of blood circulation in the extremities, in your toes, feet, ankles, lower legs, and it also compromises the nerve supply. That's why they call it neuropathy. And it causes a tingling kind of a pain, a sharp stabs of pain that go through your feet and legs. And since I've been on the plasma energy water, I've had no neuropathy at all.
And I want to add there that we did have someone who got the plasma energy station who dealt with neuropathy, and she made a spray bottle of the plasma energy station water and sprayed it on her feet and legs and said it gave great relief, that she wasn't having the stabbing, tingling that she'd been experiencing.
I was diagnosed with cataracts about 3 years ago, and I was getting to the point where I couldn't see to drive safely, and the plasma energy has reversed my cataracts. I made a combination of the different plasma energy waters and put drops in my eyes, and over a period of 4 to 6 months I started getting relief, and after a year I could see fine. And just 2 months ago I renewed my driver's license with no glasses and no contact lenses, and I can read fine print. So my cataracts are gone, and I was diagnosed with them.
And you know the treatment is surgery because you used to do that on animals.
Right, and the only treatment that the medical establishment knows about, or at least that they'll tell you about, is surgical removal. Well, you don't have to do that anymore. So I've had no amputations. I'm 79 years old and still functional. At least I think I'm functional.
I let him
So-
know most days that he is.
So,
Well, and I'll tell you a little, when we send you a plasma energy station, you'll receive a package like this that is it's wrapped in foam and bubble wrap, and it's got 16 little glass vials that have all the contents of the energies that Paul put together for the energy station. When winter time comes, we've experienced that even though these are well packaged, our temperatures get to 22 below. You're just going to have freezing and breaking of little glass vials. So instead what we do is combine the 16 smaller vials into a series of 4 vials of this size, which are BPA-free plastic. And we know that this does not break when it's frozen. I put some in the freezer, I threw them on the floor when they were frozen, they didn't break, they passed the break test for me. And we haven't had any issues of people once they get them. Now once you set up your station, oh, and I'll mention one more thing. When I send the plasma energy station overseas or outside the country, you're going to receive a set of patches. And those are going to go on the outside of the container you're going to use. It can be anywhere from a mason jar size to a 5-gallon container. It's your call. And these are going to work just fine no matter what size the container is. Once you set up your energy station,
but that container has to be clear,
yes,
glass or plastic.
yes, no opaque containers. I know you have wonderful crockery, don't use it. Don't use stainless steel, don't use opaque plastic or glass. You can use something that's translucent, that's colored, that you can see inside of. So you've got those choices. Once your station is set up, one of my relatives is going to go visit her son, and I said, well, take him a vial of your plasma energy station, because everything's in there. You don't have to fill little 16 vials, you don't have to fill 4, you can do it just with 1 vial. And then they can take this and put it on their container for their plasma water, or if she was concerned about traveling with water, she could make patches and take it to them that way. So there's many ways to do it. And once, if I have this station and I make 15 vials to give out to people, which is going to have the most strength in it?
They're all going to be the same.
Okay, so there's not a diminishing effect of utilizing the plasma water, and there's no expiration date on it. How long you think it's going to last?
It'll last longer than we will.
So, all right, so this is how you can get the plasma energy station. And also be sure and go to the shop page, the shop title on our home page. And when you click on that, it'll bring up another title called Products. When you click on that, it will bring up all the products that we have, and we're starting to do videos on all the products. So as you go through the list, you'll see that there are some that you can bring up a short video where we talk about that particular product.
And one of the last things I want to mention here is this book by Richard Bernstein, MD. He was an engineer, and then once he was diagnosed with type 1 diabetes, he went to medical school, became a medical doctor, and his practice is only for diabetics. And he wrote this book, and this is an excellent book for somebody who is diabetic, because it goes through everything you need to know, how to regulate your blood sugars. There's even a meal planning guide in here. So I highly recommend this book. It has helped me a lot. It's Diabetes Solution by Richard Bernstein, MD.
Well, I think that's everything, and thank you. We have done this 3-part series, and I hope you've learned a lot about diabetes, about managing it. And is there something you'd like to add?
The only other thing is go to plasmaenergysolution.com. That's our website, and there you can see all the products and the work that we have done. There are lots of blogs on there, and there are lots of videos. So go there and continue your education. Learn about plasma energy, because it has a lot of great benefits and someday is going to be a very prominent modality here in the United States and worldwide, matter of fact. So thank you for watching this video. We appreciate the time you have taken to do this. And if you feel you've gotten any value from it, give us a thumbs up and share it with your friends and relatives. Thank you.